Hi, I'm Dr. Veera of Optimum Health Chiropractic. What we're going to discuss today is sciatica. This video is primarily intended for our patients so that you know what to do with sciatica for you, your family, and your friends. So first things first, let's go over the sciatic nerve. The sciatic nerve is the largest nerve in the human body. It is the size of my thumb. Every other nerve in the human body is roughly the size of an angel hair spaghetti, or about 20 to 30 pieces of hair put together. If you look over here, the sciatic nerve runs all the way from the course of the lower back, all the way down to the bottom of the heel and the front of the foot. The sciatic nerve actually is comprised of several other nerves that come together to make this giant nerve. Now, the good thing about that is it's a very, very strong nerve. The bad thing about that is that if you hit any one of the tributaries to the sciatic nerve, you can give yourself what we call sciatica. Now, the definition of sciatica is different from patient to patient. That's what makes this condition so interesting and also so hard for people to realize that they have. When you have an irritation of the sciatic nerve, one of the following things can happen to you. You could have numbness, tingling, radiating pain, a sudden loss of strength in a limb, and the pain can light your leg up anywhere along the chain. Literally anywhere from the belly button on down can get lit up if you have sciatica. For example, we had one patient who came in and he couldn't feel the outside of his leg right here. And then he had a little bit of lower back pain. Then we have other patients who come in and they feel it going into the groin area. And yet we'll have other patients who come in and they'll actually feel it coming out right over here or right in the middle of the buttock. So any presentation of sciatica can be different from patient to patient. The first thing we're going to go over is the piriformis stretch. So my lovely patient Michelle, can you lie on your back for me?
Hello.
Okay, so the first thing you do is you pick up one leg and you bend the other leg over it. This motion alone can actually cause a lot of pain and discomfort for someone. If this motion already causes discomfort, stop here. This is as far as you go. If you can do this motion and there's no problem, then you hook your hand under their leg. Relax your leg, please.
Okay.
And what will happen is the patient will actually feel a stretch in their buttock right over here on the side of the bent knee. You have to hold this stretch for a minimum of 18.1 seconds for it to be effective. Ideally, you want to hold this stretch for about 2 minutes. And that way, you'll get a proper stretch of the piriformis muscle. That muscle is very important to stretch because the sciatic nerve runs through it. Now, even if patient has pain on just one side, you have to stretch both sides. You don't really want their sciatica to go from one leg to the other leg because you didn't stretch it. And you also want the patient to breathe. Patients have a tendency to hold their breath when they're stretching, so it's very important to have them breathe. Now when you're coming down, you come down nice and slowly, relax, and then you have them switch legs. And then you just hook your hand under and take a step forward. This way you protect your back as well as the patient's back. Now it's important when you're doing this stretch not to have the leg out here, not to have it here, but to have it straight forward. Do you feel a stretch?
I do.
Okay, good.
I do.
This is a very good stretch for anyone who's sitting for a long period of time, anyone who does secretarial work, work at a computer, any kind of a desk job. This is very good at the end of the day. It can also help prevent sciatica.